The discus is a disc-shaped plastic device containing a foil strip inside. The foil strip typically has 60 blisters or pockets which contain the powdered medicine. The device also has a counter window, which counts down after each dose. Like all dry powder inhalers, the system is inhalation-driven, meaning that medication is delivered to the lungs through the force of breathing in. Unlike aerosol inhalers, the medication is dry and no propellants are required to deliver it. There are 4 key steps in taking medication with a discus inhaler. To open the discus, hold the inhaler in one hand. Put the thumb of the other hand into the thumb grip. This is the hollow spot that fits the thumb tightly. Push the thumb away until a click is heard. At this point, the mouthpiece and tab beside it should be visible. To prepare the medication, slide the tab away until a click is heard. To take the medication, begin by breathing out. Be sure to avoid breathing out into the mouthpiece, as this will interfere with the medication. Next, wrap the lips tightly around the discus mouthpiece. Breathe in quickly and deeply. Take the discus inhaler out of the mouth. Hold the breath and count to 10 slowly, or as long as possible. Breathe out slowly. To close the discus, begin by holding it in one hand. With the other hand, put the thumb back into the thumb grip. Slide the thumb grip toward the body until a click is heard. The device is now ready to be used again, the next time medication is required. If taking a steroid medication, it's important to rinse, gargle, and spit out. Inhaled steroids left in the mouth may upset the normal balance and allow yeast to grow. As with all devices, proper breath technique is essential. A common problem with all dry powder inhalers is not inhaling deeply enough. In order to reach the smaller airways, the medication must be drawn quickly and deeply into the lungs. Inhaling too slowly or too quickly will also result in inadequate delivery of the medication. Again, here is the recommended technique. The position of the head is important. Make sure that the head is held not too far forward or too far backward. A good mouth seal is essential to generating the desired inspiratory flow rate. Make sure that a tight seal is maintained around the mouthpiece by the lips. To prevent medication loss, after hearing the click, avoid shaking the discus, turning it upside down, dropping it, or breathing into the discus. Because the discus requires less lung capacity than other devices, it can be used by children as young as 6. Whenever demonstrating a new technique, be sure to have the patient demonstrate it back to you. That way, you can be certain that he or she fully understands how to use the device. A child moving to a discus from a puffer and a spacer is used to breathing at a slow pace. It's important to reinforce to the child that they need to breathe quickly and deeply when using the discus. Because correct breathing technique is so important to the successful delivery of the medication, it should be reinforced and reviewed on a regular basis. When cleaning the discus, it's important to avoid getting the mouthpiece wet, as this will interfere with the flow of the dry medication. This area can be safely cleaned with a tissue or a dry cloth. Saliva on the mouthpiece will also affect the device's operation and should be removed with a tissue after each use. If the hole becomes clogged with medication, it should be removed with a brush. Because of the device's sensitivity to moisture, it should never be immersed in water or stored in a damp environment such as a bathroom. A dry room at normal temperature is an example of a good location for storing the device.